Namaskar. Welcome in the live interactive teleconference of MBA in Healthcare and Hospital Management program. Today we are going to discuss about the introductions to marketing and markets. As the student of the MBA in Healthcare and Hospital Management program, you must understand the marketing and markets. Because unless you create a market and you understand the marketing strategies, it is very difficult for you to implement the different aspects of the health delivery system. So to discuss all this, we have Dr. Atul Bhargava. Welcome you, sir. And Dr. Atul Bhargava is a very scholared person. He did his MBA in Healthcare Service Management and PhD in Management Specialty in Healthcare, and he also did his Master in Clinical Psychology, and currently he is working as consultant in accreditations body. So without wasting much time, sir, kindly inform us the objective of today's presentations in regarding the marketing and markets, and subsequently we try to understand the different dimensions of marketing and markets in context to our student.
Thank you, sir. I would like to thank IGNOU for giving this opportunity to me. Today's topic is Introduction to Marketing and Markets. So it is very important to know that because healthcare market and other markets, they are slightly different. So we need to understand the basic marketing principle for this, and then explore the various market dynamics in healthcare. Which are the dynamics which affect healthcare market? Then apply marketing strategies to hospital settings. So these are very important. These are the objectives of this presentation. See, what is marketing? This is a basic definition of marketing, which healthcare people should understand. That it's a defined process of planning and executing the conception, pricing, promotion, and distribution of ideas, goods and services. So here the goods and services will differ as compared to the other markets. It is also aimed at creating exchanges that satisfy individual and organization goals. So we need to understand that what are the organization goals are there. In this case, the organization, we will call it healthcare organization. It can be a hospital, it can be a healthcare setup which is supporting hospitals. So this is the difference between the other marketing and healthcare marketing. Now let's start with the evolution of marketing in healthcare. How it has started. It is product oriented era. Now the healthcare product which we call, these are the healthcare services. It can be maybe the associated services along with the healthcare, the direct healthcare. So we need to understand the product orientation of this. We need to basically plan as per these products. It is also sales oriented. So we need to understand that sales of other marketing products and healthcare, it is slightly different. So we need to understand conceptually about this. Then we have marketing oriented era. Now the things have totally changed. We have various other facilities, like earlier we used to use media, written media, means press media, or maybe the All India Radio or Doordarshan we used to use for marketing, maybe the pamphlets. This sort of marketing used to be done. Now it is altogether different. Then we have societal and relationship oriented era. We need to closely work with the society and the relationship with the community. That is very, very important. So without this, I think the healthcare cannot justify. It is not marketing of the healthcare marketing is quite different from other marketing. So
including everything these days, basically including social media, the feedback outreach program, means months one relative is talking to the other relative that
Correct.
I visited that particular hospital and that is very good, and I visited to that particular doctors, the doctor is very good, so or I avail this kind of government facility which is good, now you must also get that kind of facility. So I
Absolutely.
think everything is involved in this case, including your print media, electronic media, your means snowball effect, and everything is involved these days.
Correct. Correct.
And but why this marketing is very important for this hospital or healthcare service?
As we said that now the other medias, apart from the press medias, apart from the regular medias which were available, marketing is totally a different game-changing scenario. Basically, now digital marketing and the other conventional marketings are quite different. Now it all depends on the reach. So whether it is your healthcare organization, whether there is any healthcare services, and even a consultant giving services, unless until the people are aware about it, they cannot reach you. The population is huge, many competitors. So how you differentiate your services, your organization as compared to other, it is very important. So we need to design your communication and the media of communication, whether you are using SEO or whether you are using digital marketing, whether you are using conventional one or a combination of one. So what mix you are using, it all depends on that.
Yeah.
Then if you see the importance of marketing in hospital, it is very important. Now if you see the various brands, how they emerged in last 10 to 15 years, like there was Fortis, Max, Apollo. Now when you hear the name of these organizations, you understand there is a quality behind this, because over a period of time what they have done, they have built a trust, they have built a communication with the patients, and now they are perceived as an organization which are giving a best services to the patient, safe and patient oriented services. So building a brand and trust together, that is the journey of these organizations. So even the other organization, small hospitals, 50 bedded, 100 bedded, they have started working on this because they were pioneer. Now people are following them. And if you see the younger generation, they first, before going to any hospital, they will search the rating of that hospital. Then they will search the area, which area they are in. Then they search the consultant or the services for which they are looking. And then they will see the rating. How many ratings are there? What is the feedback? If any negative feedback is given, they go through that. And after analyzing, lastly they compare the prices offered. So they are very smart. They find out everything, then only they reach the end, the consultant or the hospital. So they are very focused. So the organization need to keep all those things as per the latest consumer, because the new consumer or the emerging consumer, they are very smart. And this marketing increases the patient inflow. See, if any hospital is there providing oncology treatment and people are not aware, say a remote village is there 100 kilometers away from their house, and they have some cancer problem. Now how to reach there? Unless until some media is there, they are aware and continuously hammering of that, because nobody planned that some disease will happen and then only they will search. Actually, if they are aware that such type of facility is there, that moment only they connect with this, and it is quite easy for them because they have been hearing about the organization, about the facility in their area or maybe the nearby area. So they try to approach. So that will save time. And of course, in this branding, a patient loyalty is also generated. Once the patient satisfied, means he'll become your brand ambassador. And such type of brand ambassador we really need in healthcare, because once the service is given, and mouth publicity is the best one. I think
Yes.
if you have seen the consumer marketing and sales also, they said, what you have purchased? I have purchased a Sony TV, and I am very much satisfied. So whosoever is there in the family, elder one, the younger one will try to follow. So mouth publicity is a big advantage, and a satisfied customer or satisfied patient itself is a big asset for the hospitals or the healthcare institution. You have a competitive advantage because you are able to place your positioning of the organization. At the same time, you understand the need of the market. You understand what is required to your patients. So you tailor-made all those communication and deliver it to the community, so that when there is a requirement, they need not search it. It is ready-made. It is on the top of the mind. And see, if we see slightly SEO, in that case, you will find that the moment you want to search any hospital for oncology, the first name will emerge, second name will emerge, and third, if you see the percentage of clicks in first and second, first it is 80%, second is 15 to 20%, rest it is just 1 to 2%. So that is how you place your organization. So if you are seriously involved in that, so either you follow the organic media, or if you want to have a paid system for this, so you try to make your search easy for the consumer and make it available at the first click only.
Yeah. So now the question is, what are the core components of the marketing? Although there is like many allegations that this digital marketing or the Google ranking is often manipulative, and it is some kind of paid service by which you can increase the rank, and all other allegations are always there. So the core concept of marketing are also are they addressing those issues?
See, I think anything which is new, society will not accept as it is. So there are some pros and cons, and definitely what you are saying, up to some extent, it is correct also. If you don't give a required service or a good product, customer will purchase once, twice. After that, you will not have any market. So need to have a stronger background for this, and to understand that, we need to understand the needs of your market, who's your customer, what they actually require, and what are their demands basically. See, what you perceive, what the organization perceive, what the customer perceive, what the patient perceive, altogether different. When they align all those things, then only the actual marketing or sales will be done. Without that, it is not possible. So it is totally a scientific procedure. And there are products and services. If you don't have good product and the satisfactory services, I think once again the issue remains the same which I said earlier. If you don't give a good product or service, the patient or the customer will not come to you. So in this case, it's a really question of life and death.
Yeah.
So the product or the services which you are offering, it has to be top class, patient center, and moreover, it should be safe to the patient.
Yeah, I think the other marketing service and the hospital and healthcare related service, the difference is only that if I purchase some kind of faulty brand of TV or some kind of pressure cooker or some kind of refrigerator or washing machines, it may not lead to me life and death or life kind of questions.
Absolutely.
It may be my monetary loss, but if I choose some kind of unstandard or health service which is not as per the standard or the quality is not maintained,
correct,
it may lead to the death or life kind of situation. So I think this is the great difference of the healthcare or health related or hospital related service or marketing, where we need to be very, very careful, because the life of an individual is depending upon the quality of the service. So I think
I can correlate with a small joke. Doctor used to visit a car mechanic. So car mechanic used to give him very good service. Sometime 200 rupees, sometime 500 rupees. So once it happened that the mechanic got sick, and he went to the same doctor, and that doctor charged 50,000 rupees for a particular operation. He said, Doctor Sahab, this is not fair. I have given you the best services, and every time I charge 200 rupees, 500 rupees. So what is the difference between this? We both of us were giving good service, and in both the cases, the customer is satisfied. Tell me why there is a difference. He said, when we work, the engine is on. So we work on live machines. We don't work on stationary machines. Yeah. So that is the only difference. Whatever action we will take, if it is something wrong decision, it can harm a life. So that is why we charge this. Yeah. And in your case, it is 200 rupees. So once again, there has to be value and satisfaction, because whatever the services are given, it should have value along with that, and that only makes a difference, and that leads to satisfaction. Then exchanges and transactions, market and relationship, these are also equally required to understand this.
We also need to understanding the healthcare market in this context, because as you said, there is a demand and supply, and there is expectations of the people, affordability of the people on that particular area. Correct. So how to understand the healthcare market?
See, as I said, the other market and healthcare market, they are different actually. And to understand this, we need to understand that your product is basically different, your market is different, and your provider is different. So in this case, the provider is healthcare organization, and the product is the service you are giving. And to whom you are giving? It is the patient, the sick patients. And naturally, all the potentials which these services are there, that need to be utilized as per that. It cannot be seen separately. And influenced by demographics, disease pattern, because see, what happens if you go to some state, say Bihar, there will be some prevalence of disease. If you go to Kerala, it will be different. So we need to understand the demographic profile of a particular place. So then only we can plan. Then disease pattern, somewhere you will find that the patients are suffering from thyroid.
Somewhere communicable disease may be more, somewhere the hypertension or diabetes may be more. So it's depend upon the
we need to understand
area.
Apart from that, the policies also we need to understand whether those policies are suitable for that class of patients or not. Then insurance system, still this is a very big sector which is I think
in India it is emerging right now.
So in next 5 years it will be almost, I think, doubled. Yeah. So the service differs, because the patient who is insured, he can have affordability, and he can straight away walk into the health organization and can avail all the system. But majority of the people who are not insured, they need to calculate the per day expenses are there, and really it pinches the pocket. Then we have to see the segmentation, market segmentation in hospital also, because if you see the demographic profile like age and gender, if the patient is say below 18 years, then you need to cater a different service. If it is up to say 50, non-communicable disease are there, then we need to take care of that. If it is male and female, the services differ, because you need to have a maternity service, you need to have a pediatrician also, it is required. So it depends on the age as well as gender. Then whether the population is from urban or rural, because the understanding maybe the financial criteria, maybe the approach of the patient that differs. Then psychologically, it is a very important factor, the lifestyle and the beliefs. See, when you are talking to a educated segment, most of the things they understand if you explain them, but they try to argue. Whereas in case of rural population, what happens? They will follow the treatment, although they don't understand, but they follow as it is, because sir has told us this is the step, first step this, second step this, and first day we have to take this, next day this will happen, like that. So the sequence is accepted to them. Whereas in case of urban class, it's slightly they argue that because they feel educated and they try to plan in their own way as per their feeling what they have. Then we have a behavioral problem also. Service usage pattern. See, it is totally human behavior which decide that, because we never plan medical services in the initial month. Like on first to 5, you plan that you want to purchase this thing, you want to.
It is not like
holidays.
Planned activity, because emergency related health can be happen any point of time.
So we have to understand that this is an unplanned service which require. It can be urgent. It can be maybe the amount involved will be very high. So you never plan. So that is why the concept of insurance is very, very important for them.
Yeah.
Then we have targeting and positioning. How you target a particular market or a patient or oriented say customer, you can say where it is suitable. So depending on the various factors, say if anywhere, say if it's a manufacturing unit of cement, there you will find more and more patients having a respiratory problem. Asthma will be one of silicosis will be one of the diseases which you will find. So you can plan according to that. And of course, positioning, creating a distinct image in the patient mind. That means, say a particular specialty hospital is there. They want that we have a very good faculty, we have very good surgeons, we have a very good service, nursing staff is also skilled. We can be a very good cardiac hospital. So what they do, they put all the resources in that direction. And they also know that NCDs are main, the percentage of NCD,
number one
non-communicable disease, they are growing like anything because of our lifestyle, because of our various other issues, pollution and other thing. So that becomes a very, very important issue. So what is your vision of your organization? How you plan that you want to put all resources in that direction, and position yourself anytime. Say if you say Fortis, okay, cardiac, it is a escort, say Dr. Trehan is there. So that means related to cardiac segment. So that kind of connectivity is required.
Yeah. So in this context, they are often told about the 7 different P's of the marketing.
Correct.
Particularly in the healthcare. So what are those 7 P's?
See, you can take product is one of them.
Yeah.
Then price is very important. Although people say that price is sometimes it can be negotiated, sometimes it can be ignored. But I feel it has to be affordable according to the services given. Then place, where you are giving, whether that service is approachable or not, accessibility. So we see various national programs, we see the accessibility of the patient, whether that service is accessible to the patient.
For example, like AIMS is the central of the Delhi, but it is not accessible for many people, even staying nearby AIMS. Because it is very difficult, because number of the load and number of the waitings are so difficult.
Right.
So rather than entering to the AIMS, somebody may be going to nearby Fortis Hospital.
Absolutely.
Or Escort Hospital. So that may be the place, as you said, and accessibility.
Then how you are promoting, then people, to whom you are addressing, the kind of facility, means skilled people you have. If you have a very good post-operative care unit, the nursing staff is skilled. You know that after a successful operation, your staff will take care of the post-operative care, and that becomes a very good advantage. I've seen many places where the surgeon is very good, but the other staff, the post-operative care staff or the nursing staff, they are not able to handle it, and some or the other infection has emerged in the patient later on. So ultimately, the credit and discredit goes to the surgeon only. So we should know that what kind of people we are. Then process. It's a process now. We need to. It's not that we can just start a process and we should go into this, and as the process is evolving, we should also do this. So it should be a planned process. Each and every plan should be meticulously planned, and there should be a backup system with this. If something happened, we need to have a backup with this. And then, like, you have a very good surgeon, and on the day of operation, a nursing staff is there, which is very skilled, missing. What will happen? The whole surgery will be into doldrums, because the surgeon is not comfortable, because the nursing staff which is going to assist is not there. So you should have always a process like that. People are ready. Means if somebody is not there, automatically some other person will be taking care of that. So you have a process in such a way that your activity cannot stop. Then physical evidence. Naturally, whatever you are giving, that's evidence basically. So that is real. We are not talking about anything virtual. It is physically available.
Is it talking about some medical record related things?
Absolutely. Because when patient in some of the medical legal cases, if the patient is not satisfied, reaching the legal department or the consumer court that we are not satisfied later on, because they can claim after 1 year also, they can, within 1 year they should approach the consumer court that we are not satisfied with the service and there is a medical negligence. So if you have everything systematically, processes there, your medical record department is keeping all the records, updated records, and that can be produced. Your system is accredited, so that the evidence can be easily given, and any organization can come out of very difficult periods, which is normally very difficult for any healthcare organization.
Yeah, because these days the legal awareness is improved significantly among the patients also. So the patients are also treated themselves as a consumer, so they are often going to the medical legal case. And I think the evidence, whatever available in hospital, may be one of the safeguard, either for the both way. It may be benefit to the patient if there is any negligency, but if there is no negligency, it may be beneficial for the physicians or hospital who have totally dedicated themselves with the proper procedures, with the recommended guideline, they given service to the patient. Both the way, it is win-win situation.
See, it is very clear that if you say that I have done a very good thing, very good services, got very good operation, and everything was fine.
But if it is
where
not
is the
recorded?
documentation?
But if it is not
where is the
recorded?
documentation?
Yeah.
You need to have evidence-based documentation also, no? So if you want to say 1 o'clock this thing happened, after 1:30 this thing happened, then you have a sequence of that. So that itself tells you that your process is correct and everything is in place, everything is documented, which has taken place.
In spite of that, sometimes uneven things happened in the healthcare sector.
Absolutely.
But I think the evidence can really protect the physicians. But in the same time, it can also give the justice to the patient if something is wrong on behalf of the hospital.
Correct. The court says that death doesn't mean there is a medical negligence. If the doctor or the healthcare professional has performed the duty
as per the standard operating procedures,
it is fine. And if you have documented this, then there is no point in saying that there is a negligence in this medical service.
Yeah.
So that's why most of the organization must have seen, they are going for accreditation. And in accreditation, what happened by default, this is a system that they need to record everything.
Yeah, you have to maintain the record.
In
particular year, you have to maintain that physical record. In fact, almost all good hospitals, they maintained a medical record department. There is a separate department.
Whether it is a good hospital, whether it is a bad hospital, they have to maintain. Something is statutory requirement, so it comes under that. So anytime, because any dispute can be arised in 25 bedded hospital also, and a multi-group hospital also. So and the problem will not differentiate in the category of hospital.
So what are the different product strategy in hospital, particularly when we talk about the product strategy? Because in hospital, service is the product.
Absolutely.
So what are the different products strategy we have?
See, we have medical services.
Yeah.
Your patient is coming, getting a consultation, maybe physical, some pathological examination is required. Then further investigations are required, maybe radiological investigations are required. Then the operations, the CT scans, various medical services. These comes under the medical services. And outpatient care, the patient is visiting and they are taking consultation with the doctor, taking medicine, or maybe going for some small test and going back. Then we have diagnostics, like where thorough if the diagnosis is not coming out very clearly, the healthcare professional, they take advantage of this diagnostic, because it's a patient can ask why you said the patient is suffering from this disease. You have not confirmed it. If you have a diagnostic report with them, you can correlate with see, this is the diagnostic report, which is a document itself. And now my prescription is also tallying with this. So that is why we have initiated this. So that makes a line of treatment very clear to the patient, as well as to the people who are along with the patient also. Then emergency, of course. Emergency is basically many hospitals, they give this service, and many hospitals, they don't give this service because of the scope of services. But they need to display. See, like in front, in the outer side of the hospital, there should be what are the services you are giving, that should be displayed. At the same time, what you are not giving, that should be displayed. And the prominent service, like if you don't entertain emergency, you need to display that we don't have emergency facility, although it's your duty to stabilize this patient and then refer to the further hospital where they can get treatment. But you need to mention that and display also. This is a compliance which every healthcare organization need to follow this. Like there was some strike of doctors earlier, that every hospital, whether it is 10-bedded or whether it is clinic, they have to give emergency services to the patient. I think nothing wrong in that. If you give a basic help and explain to the patient, look, we have this setup, and what we are doing, we are giving this basic service, and we are trying to stabilize this service your patient, and later on we are communicating to the higher facility which can take care. So that makes a sense, and I think life is really precious. Anybody who is losing a life, it's a loss to the nation, loss to the family, loss to the community. So we need to preserve that, and you should have a sense of empathy. So nothing wrong in that, but only thing, patient also gets emotional. They try to take advantage of the situation, that okay, you have to give this, why you have not given this. So without understanding what is the scope of the healthcare institution. Then, as I said, focus on quality is the important, because unless until the quality is maintained, the patient care and the patient-centric approach cannot be achieved. Then, of course, innovation and specialty service. If you have, say, some specialty service which other organizations nearby are not giving, so that becomes your prominent point of promoting your organization. And you can further improve by using various platforms of say digital marketing, or maybe through SEO you can improve your organization ranking.
So in this product, can one of the product be researched in a hospital? Because with the research also there are lots of many things, new things are coming up. So do you think research can be one of the product of the hospital?
Why not? Why not? Because they are after all academic institution, and these cases are, every case is a unique case.
Yeah, even training can be one of the product.
Even training can be given.
Yeah, because we are training many like postgraduate student, undergraduate student,
Absolutely.
nursing student, the allied health professional. We are training many of them. So I think training, research, educations can also be means part of the product strategy. So now next step we are talking about the pricing strategy. So how this pricing strategy can be?
Pricing is very important. Where your healthcare organization is based, and the quality of treatment which you are giving, and the demography of the place. If you are giving a treatment of 1 lakh rupees for appendicitis in a rural area, I think not a single patient will come. Whereas in metro, if you are going for this particular problem, I think people are insured, people can afford, and they look for quality, they look for safety of the patient and other also, because what I said now, what you perceive and what patient perceive, these are two different things. Patient perceive hospital is good, very clean, AC is working, a separate bed is given, a TV is there, a fridge is there in the room, which is a comfort to the attendant also. So their perception about the good hospital is this, that cleanliness. Okay. At the same time, as a clinician, you want that the patient should be given a best clinical services. The skilled staff should be there. Diagnosis should be accurate. Required facilities for pathological or radiological investigation can be done in-house. So your perception about is different. Patient perception is different, but need to match, and then only you get the advantage of this. Then competitors are there. Of course, how you place yourself, because as more and more medical colleges are coming, in coming years, this will be a really cutthroat competition, because when so many medicos are there and going for super specialty, maybe as a community doctor only, there also the competition will be very high, because what treatment you are giving along with medicines are given. If somebody is getting the same treatment in same money, so he will say, why you are charging for consultation only? So there will be a competition. So how you differentiate yourself with the other, that is very important, and I think that plays a very important role. And perceived value, I said, what you perceive the value, like if the safety is a big issue, then safety is given, and it can be explained to the patient also that look, it's not necessary if the patient is operated for appendix, if there is some additional problem after opening means after incision, if the surgeon founds there is some other complication, if you have a multi-specialty, if you have other, say maybe some kidney problem, if you have a neurosurgeon, it is freely available. In case of other facility where it's only a general surgeon, he may or may not take care of that. So they need to explain that the advantage of coming to this institution is this, which is as compared to other organization, we are better off, and in case of emergency we can deal, and they can show the various comments of the patients which are on the say digital media also, that look, this patient was there having such complication, later on it was found having this complication also, was very well managed, otherwise in case of other institution it would have been different case. So perceived value has to be there. Then models like tiered pricing, bundle package, subsidized rates. Now you see when you go for delivery, okay, said take a package, And what that package? Right from the conception, means once you visit a gynae and say the lady is pregnant, right from the day one, every medicine, every consultation, every pathological investigation will be included in this package till the time of delivery. Even up to 6 months after this, we will follow this. So person who can afford it, they perceive that, okay, this is a package, I have to give once and I'll be free. So n number of times I'll go, there will be no charge. Then depending on the various cities, various services, various skills, it can be graded one. Like for grade 1, it is this pricing, grade 2 it's like this. If you add on this, then different tiered pricing can be there, depending on the facility you are giving along with this. Then subsidized rates, say any organization who has, say, maybe their ROI is achieved and the instrument means the machinery is quite old. If they want to and still giving very good service, because they have recovered the initial price as well as they have got a good profit, they can very well give a subsidized rate, which becomes an attractive feature for the patients, and they can pull further traffic to the organization. Then we can see the place is very important. As I said, now the accessibility is very, very important, because now the endeavor is, see, anyone staying in 5 kilometers range or 10 kilometer range, it is very important that whatever the services are given, it should reach that patient. And that is why government is taking many initiatives, like they are opening UPSC, PSCs, and even the healthcare wellness centers they have started opening. So based on the, say, 5,000 population, they have a healthcare setup which can cater the nearby places and giving the basic facility to the patients. Likewise, we have satellite clinics, online consultation is there. That is very important. And a referral system should be there, and ambulance services, because if you have that service, say you can give that service, but if your setup is not having and the scope of service is not available, definitely you can refer, but with stabilizing the patient, and you need to send a healthcare worker along with that as per the prescribed means norms. And then handing over the patient is very, very important, because what will happen that okay, I have sent a patient, now my responsibility is over. So till the time that patient reaches the other referral area, it's your responsibility. So you need to put it in your SOP that we need to follow this. And same way, ambulance services also. If you have ambulance services, if it is chargeable, it is not chargeable, you need to specify as per the SOPs. Then it should be also conveyed to the patients also, because somewhere it is free of cost. Somewhere in case of death of patient, they feel that okay, we have to give this service free of cost to the patient in case the patient dies. Okay, but in other hospital, the same service is not given. So this thing should be made very clear to the patients that whatever the services you are giving. Then you can have a promotion strategy, like awareness campaigns. Okay, you have say you can arrange a small camps, health camps, digital marketing. You can use that this service is available. Then you can have a partnership with say if you are a small hospital, you can have a partnership with the other hospitals who is bigger in service. You can to put together, you can plan some activity. Then focus should be on transparency, trust, because if you talk to patient, they will say there was no transparency. We were not knowing about the prices of the particular services, and doctor said something that the trust is not there. So the trust has to be developed, the transparency should be there, and health literacy should be focused. Then people strategy, if you talk about people strategy, doctors, nurses, support staff as brand representative. These are the basically brand representatives. So they need to be in line. Whatever the scope of service is there, they should provide that. Training, communication skill and patient engagement is very, very important. Any organization should focus on this, because skilled professional is an asset for the organization. Then it should be seamless. Process strategy should be seamless. Admission to discharge cycle means there should not be hiccups, there should not be gaps in the services, so that patient satisfaction will hamper that. Because if the patient discharge, say morning you have discharge, and patient and the discharge ticket is ready by evening, that means whole day the patient is spending time in the hospital doing nothing. And same way with the admission process also. Then documentation should be very efficient. Billing and feedback system, there should be feedback for the patients that okay, we whatever grievances are there, they are addressed, and feedback system should be there and should be answered also to the patient. Then of course the environment should be very clean, it should be uniform. Now as per the government hospitals, you will find everywhere the same color scheme, the same color codes, size of the signages, everywhere it is same. So they are, even the government is focusing on means uniformity of signages, infrastructure, everything is same. So the moment the patient enter in any village or any district, we can understand this is a government setup. And tangible cues that influence the perception of care quality. So nothing should be intangible basically. Whatever is your cues are there, it should be tangible. Then branding elements like name, logo, colors, mission statement should be done with the professional care. Manage through service quality, patient reviews and CSR activities. That is a part of any healthcare organization. They feel that this later on we can work on this and improve our services. Then challenges in healthcare marketing, ethical boundaries are there. You cannot promote your name of the doctors and all that you know very well. There are regulatory instructions are also there, and misinformation and patient exploitation should not be there. There are risks balancing commercial and care objectives. It is not a commercial activity, so we should understand and we should differentiate with this. So I think on this topic we have
covered many things, and particularly the last whichever you told, that ethical boundaries while marketing it. I think it is very, very essential for the hospital as well as for the doctors, that they need to means respect the ethical guideline of the statutory authority like NMC, or every state has its own state is a state subject, central subject, and concurrency.
Healthcare is basically a state subject,
yeah.
But it is not only a state subject.
Yeah, this is the reason we need to respect. There is an NMC guideline which state also need to be respected. You cannot say that we are state, we will not respect to the NMC guideline. So there is a different kind of, but of course the most important point here is healthcare marketing is very essential and crucial, because here it is not a simple product. It is, in the name of product, it is a life.
It's a life.
So we have to be double sure that somebody may purchase defective refrigerator or defective TV or defective mobile, but nobody can afford to purchase the defective service which may lead to the death kind of situations. And one that for a individual may not be that much of things, but you just think about the family point of view, the society point of view, and the country point of view, because every individual is important to the
There
nations.
is no U-turn in service,
yes,
in human service.
So this is the reason I think we have to be very, very careful about the marketing of the healthcare services. Although there are many challenges, many competitions,
absolutely,
but we need to be very much constrained with working with the all ethical guideline, and the main aim to be how to provide best service to the maximum number of people with the affordable cost.
Absolutely.
And we are very much thankful to
Thank
Dr.
you.
Atul Bhargava coming here and giving us this much of inside knowledge about this marketing in healthcare services. Thank you very much.
Thank you.
And we also would like to sincerely thanks to our team of EMPC who is helping us to broadcast this program, and thank you to the all students who are viewing us. Thank you very much.
Thank you.
Namaskar.